I would greatly appreciate that.
Thank you, Senator Stone. Any other questions for this panel? Seeing none, I'd like to thank and excuse this panel and call up our third panel, issue number 3, which is trailer bill language on child care vouchers. For this panel, we have Jessica Holmes back from the Department of Finance. Virginia Early stays with us from Legislative Analyst's Office, and Deborah Brown from the Department of Education stays with us as well. This is the first of 2 panels on this issue, on issue number 3. And I'd like to apologize for having to leave for a few minutes, but I want to thank my co-chair for taking over.
The whole thing.
Okay, let's begin with Ms. Holmes from the Department of Finance.
Hi, yes, again, Jessica Holmes, Department of Finance. Again, we did provide a presentation on this proposal in the full Senate budget hearing. So I won't go into too many details about what's provided in the governor's budget. However, I will say that we will be providing additional clarity in the May revision as to what we have in mind for this proposal. Just want to clarify, because there seems to be some confusion, that we are not proposing to move to vouchers next year. We see any change in the child care system as being one that happens over a period of years and with much discussion, and that's why we are proposing a plan as opposed to an actual change. When we speak about vouchers and this new verb that I've been hearing of voucherizing the system, I want to stress a couple of things that you will likely see in our language in May. We're looking to create a single equitable system of care. We want to focus on a single simplified rate system, which is something that I think a lot of folks have been talking about lately, that has some transparency in terms of what we're actually providing in comparison to our most recent regional market rate survey. We also are looking to have a single set of quality standards. As I mentioned before in the conversation with Senator Mitchell, we know that we have a Title V program and a Title 22 program that each have different minimum quality standards. So we're looking to create a single system that allows all children to access a certain level of quality. And we're also, again, as I had mentioned before, looking for ease of access for families and administration for providers. So those are some of the things that we're going to be looking at as we move towards the May revision. I also want to recognize that there are many discussions that are happening and have been happening for many years now in regards to quality rates, access, especially for infants and toddlers, income eligibility, continuity of care, and the federal CCDBG reauthorization. And we recognize that those conversations are important conversations to have, and that they will likely be had within the context of this discussion of looking at a single system.
Thank you, Ms. Holmes. Moving now to Ms. Early from the LAO.
Thank you, Mr. Chair, Madam Chair. So overall, we think the proposal to restructure the child care system and move it to a voucher-based system is moving in the right direction, because it would allow similar families to have similar levels of choice in selecting a provider that meets their needs. Currently, some families have different levels of choice. So we would recommend that the legislature pursue the proposal with some modifications. We think that the legislature should require all child care programs that are serving children birth through 3 to include developmental components in their care. And we also think that we would recommend that the legislature take this opportunity to improve the current child care system by equalizing service levels across counties and replacing the current rate structure with a simplified and more market-driven model. Thank you.
Thank you. Move now to Department of Education, Ms. Brown.
Deborah Brown on behalf of State Superintendent of Public Instruction, Tom Torlakson. So my comments here on this one will be related to the proposal as it came out in January, and not any changes that may occur with the May revision. And so as we look at this, the language that it was proposed in January would require us to develop a plan that is a transition from contracted funding into vouchers over 5 years. And so the development process, we think, would help the department determine the strengths and concerns of this proposal, and those conclusions would be reflected in that final plan. We do have some preliminary concerns related to equity and access that we would want to make sure would be addressed, because this does represent a fairly significant shift in the delivery of child care. I would also like to add that we do value the mixed delivery system of child care providers and setting types, and understand the benefits of families having the choice to select their service and delivery method. If we are tasked with developing a plan, we see it as the opportunity to definitely have a transparent development process. So while we would be ultimately responsible for the plan, the development would include various input sessions and a wide variety of stakeholders. And we think that the AB 104 stakeholder process that we just talked about is probably a pretty good model for that level of input. This in-depth review of the existing early learning and support programs, we would look at strengths and challenges of both direct service and alternative payment contract systems and identify the issues the state should overcome with any reform package. And we do look forward to the opportunity to work with stakeholders and the administration if we're charged with developing such a plan.
Thank you. Question for Department of Finance, Ms. Holmes. The Department of Education wants a mixed delivery system or seems to want to continue that. It sounds like the governor's office is looking to move away from that. Would you discuss that?
So to clarify, we are not looking to move away from the mixed delivery system. I think the concern that we've heard from folks is that by looking at a voucher system as opposed to a contract system, that might affect the fiscal viability of folks who really use contracts as a base of funding. And I think that's something that we're interested in exploring as we're looking at CDE kind of looking into what that would mean to go into vouchers. But we certainly don't, we recognize that, private providers, community-based organizations provide really the majority of the care in our state, and certainly it would not be to the benefit of anyone to eliminate their part in this process.
So the governor's office doesn't buy the argument that moving to strictly vouchers would cause closure of some of those?
I think that what we're looking at is a way to provide funding for care in a way that is streamlined and makes sense and provides the maximum opportunity for families to choose a care that suits their work needs. There are some contract-based centers that do provide 24 hours of care, but a lot of the after-hours care and weekend care is provided through vouchers, some to license exempt. And so we want to make sure that if we are moving to a streamlined system, we're maintaining the maximum options for families to utilize the type of care that best works for them.
And LAO, where do you weigh in on this in terms of maximum options versus strictly a voucher system?
We think that these sort of concerns could be addressed through a transition plan. For example, a center that's currently contracting through the state to provide care for a certain number of children, their contract could be reduced while those same children that are in the center could be given vouchers over a period of time so that the children would continue to choose to use their vouchers in the same center they'd received care in. And so we think that it could be addressed through a well-designed transition plan.
Anyone else on the panel want to comment on that question? Ms. Brown?
I would agree. I think that the plan, the development of the plan with appropriate stakeholders does provide a good opportunity to look at all of these issues. And as long as there's parameters around us when we develop the plan, but it doesn't assume a conclusion at the end of the plan, that it does allow us to take in what's currently happening, work towards an appropriate system, but not direct us towards something that's absolute, I think is probably the best approach.
Okay, thank you. Other comments or questions from the committee? Mr. Morlock, Senator Morlock.
Thank you, Mr. Chair. Ms. Early, it states here that the LAO estimates an additional $25 to $70 million for the voucher system, but it doesn't, that's all it says. So what does that mean?
So on average across the state, the contract system is reimbursed through the standard reimbursement rate, and the voucher system is reimbursed through the regional market rate. On average, the standard reimbursement rate is lower for infants and preschool-aged children in centers. And so by moving the slots that are currently reimbursed with the SRR into an RMR system, there would be some additional cost for certain of the slots.
Thank you.
Holding the rates constant.
Other questions? Senator Stone.
Thank you, Mr. Chairman. I'm glad to hear that this is a plan that's going to be implemented over some years, because I think we need to be very careful in going from, contracting to vouchers, because, and we need to, of course, keep our providers as one of the stakeholders in this process. We shouldn't have any kind of knee-jerk transition that's going to put a lot of our providers potentially out of business. So I'm glad that we're doing that in a very sensitive way. And then if you'll please excuse my ignorance on this, but we are witnessing a healthcare crisis in the state of California and across this country with autism. They're saying now that 1 in 50 kids are being born with autism. And I know that the primary services that the state provides for autistic children is through the regional centers. So are vouchers or contracting, does that exclude autistic children, or does that include them in conjunction with the services they get at the regional center? And if we do go to a voucher system, because we know that the cost of taking care of a child with autism is much greater than just taking care of a healthy child, will there be any kind of specialty vouchers for those patients or for those parents who are struggling with very high medical expenses to take care of these children, be able to place their kids in specialty child care centers? And if the voucher doesn't even cover the cost of that, can they still use a voucher and pay the difference so that they can get their children into supportive child care programs?
So the current vouchers can be utilized for children with special needs, including children with autism. There is some priority written into the language for children with exceptional needs. For example, on a waiting list, if families have similar income and have similar family sizes, the child with exceptional needs is prioritized over the child without exceptional needs. And in certain cases, children with exceptional needs who are receiving child care in a voucher-based setting are those providers are given a bit more than the rate. So there are adjustment factors for those children.
Thank you. I appreciate hearing that. I'm glad to hear that exists the way it is structured. Thank you.
Thank you. Senator Mitchell.
Thank you. I was just going to restate again for the record. I think that the subsidized child care system in California, people often like to say it's broken, and I don't subscribe to that, because hundreds of thousands of children are receiving care every day by a system. Is it a system that's under-resourced? Yes. And so as we continue to have conversations about streamlining, for me, that's simply moving the same deck chairs around in a different order on the deck. I would much more appreciate the administration making a commitment to not only thoughtful, strategic reframing of the system, but also ongoing investments, to simply have streamlining proposals year after year that don't talk about new money investments in the system, I don't find helpful. Thank you.
Thank you, Senator Mitchell. And we have public comment coming up in a little while, not quite yet. I'm sure we'll hear many requests for more investments. With that, if there are no further questions for this panel, I'd like to thank and excuse panel 1 on issue 3 and invite up panel 2. Panel 2 consists of Catherine Goins she's Assistant Superintendent, Early Education Administration in the Placer County Office of Education, and Rick Richardson, President and CEO of Child Development Associates from San Diego. These panel number 2 will be discussing both issues number 1 and issue number 3. And we will begin with Ms. Goins.
Morning. I am very excited and honored to be with you today. I actually like politics, and most politicians in the process, it has been my experience that government at its best is efficient and effective and brings equity where the free market might not. So I'm truly grateful to have this opportunity to be one small voice in a very big conversation. A little context, I've spent 25 years administering programs funded by the state of California. Proudly started as a child care and infant toddler teacher, and right now I work in 2 worlds, the early childhood and the K-12 world. I have been at my job for the past 12 years, so I was there for the good old days of 2007, so I do have a comparison. Our program has been around for more than 40 years. We do have almost every contract that you can possibly have for the state of California, as well as Head Start, Early Head Start, First Five, and all the CalWORKs childcare. So our perspective is one of unity and what it feels like to have all of those contracts. I can only speak for Placer County, which is relatively small compared to some other counties, but based on conversations that I've had with my colleagues, I do believe that our experiences are similar to my colleagues in smaller and larger areas of the state. I have been told that my unbridled optimism is one of my most annoying qualities. And as hard as I have tried, and as much respect as I have for Ms. Holmes and Ms. Early, I just can't be optimistic about the governor's proposal. I'm very grateful for the administration starting this important dialogue about the early learning system, and while my county would greatly benefit from a more streamlined and flexible funding approach, for our county, this proposal brings up more questions than answers. I have 3 brief comments about the governor's proposal. First of all, it doesn't build on the existing successes of the current system. It creates a new unknown one. For me, it feels like it's blowing up the system rather than shoring it up. And our system is complex, but so are the needs of the children and families that we serve, and Placer County has been very successful with our mixed delivery system. While moving to a total voucher system, even over time, would seem to increase flexibility, it would actually decrease access in Placer County and decrease parent choice. Not everyone takes the vouchers as it is because of the low rates, and even those who do take them have very limited space because of competition with the private sector. In Placer County, we don't distinguish childcare and early education as this proposal does. We look at part day, we look at full day, but we think children who are learning need care, and children who are in care should be learning. And so we're really concerned when we hear talk about minimum quality standards for everyone, because that would actually take us, like many counties, backwards, who've been working really hard on increasing the quality of care for everyone. Second, this proposal doesn't increase reimbursement rates. I'm one of the counties that actually gets a lower reimbursement rate than those who have fewer requirements. I understand that there are limited resources, and we are a very fiscally conservative county. I'm known for pinching a penny until it cries. But each time funds become available, I'm faced with a kind of a Sophie's choice. If I don't apply for the funds, people say, oh, Placer doesn't need any funds. They didn't apply for it. But if I do apply and get them, then I have to operate with insufficient funds or struggle to try and pull some together. And what's happening in our county is my staff, who are largely women and mostly people of color, are paying this price because they're getting wages way below they deserve, and most of them qualify for the programs that we're actually implementing. And according to the Department of Finance, you know, they want to reform this program before investing in it, but as Senator Mitchell just alluded to, it kind of feels like rearranging being asked to rechange the deck chairs on the Titanic before you can stop it from sinking. And our early childhood system is sinking, and we really need funds to keep us afloat. We do not have one subsidized infant toddler center in the 1,500 square miles that Placer County covers. We are struggling to open our first full day state preschool, but the lack of facilities and low reimbursement rates are barriers that we can't seem to overcome. Combining TK and pre-K doesn't address our facilities issues. I'm confused about how that reimbursement would work, and it would make it a lot more complicated in our county. And finally, this proposal doesn't update the eligibility guidelines to reflect the current SMI. As Senator Jackson said earlier this morning, we actually have families who turn down raises as low as 10 cents to 50 cents an hour, because even if they're $1 over income, they are not eligible. And I have people come into my office and they're crying and they're begging, they're gonna lose their child care, and I can't help them. In summary, this proposal would mean great losses for Placer County. We would lose our mixed delivery system, parent choice, our partnerships with Early Head Start, and hundreds of thousands in federal dollars. We would lose our family child care home education network, putting 40 women-owned small businesses out of business, and we'd lose the quality that they provide. I respectfully ask that you consider investing in California's early learning system by considering a few principles. retaining our mixed delivery system, implementing changes slowly but with input from stakeholders before the plan is presented so that we can actually have input rather than just react to proposals. And rather than dismantling the current system, let's look at what's working and build on that. And I thank you for your time.
Thank you. Appreciate the enthusiasm
She would give us a copy of her.
and the information. And we've been asked if you have a copy of your comments, if you could provide them to the sergeant, and we will get them distributed to the committee. Thank you, Ms. Goins. Now we move to Rick Richardson from Child Development Associates.
Good morning, Chair Block and Chair Mitchell, members of the committee. My name is Rick Richardson. I'm the president and CEO of Child Development Associates, otherwise known as CDA. I'm also a retired Army colonel, so I share a unique perspective about education and its importance. I'm here today to share my strong concerns about the governor's budget proposal to dismantle a well-working system. As my colleague has said, that system's in place, and instead would like to share several recommendations from the field on how to fine-tune the current system to retain the high-quality early education that our low-income families deserve. Now, a little bit about CDA. We are not a school district operation. We're a nonprofit, community-based organization. We've been providing early childhood education and family support services for 42 years in San Diego County. We have a unique perspective because we're contracted both as an alternative payment agency, state preschool, and a child care food program, together totaling serving a population of children of over 20,000 throughout Southern California. Now, as a community-based agency, our greatest strength is 42 years of networking within our community. That's with parents, child care providers, social service agencies, schools, government officials, and local business leaders. And we all have the same goal in mind, the high quality early education and wellness of the whole child. But the bedrock of what makes CDA successful as a community-based agency is the strong foundation of trust that we have with our families. They know that they can turn to us for help without the stigma of the local welfare office, and we understand the needs of those families, which allows us to best meet the specific needs of those families. Now, a little bit about our Title V state preschools. We operate 3 of those preschools under contract with California Department of Education, the oldest in operation since 1985. These are high-quality programs taught by teachers with decades of experience. 2 of our preschools are nationally accredited, and all 3 are Tier 4 or Tier 5 rated according to our county quality rating improvement system. Now, 2 of them are located on elementary school campuses, and we operate those in partnership with our local school district. We work together as a team of public and private partnership to ensure that we meet the needs of the community, and we have developed relationships between the preschool teachers and the kindergarten teachers to best meet the child's needs and smooth the transition from the community-based agency into the school system. And finally, our curriculum is based upon the Department of Education's Preschool Learning Foundations, which aligns with the Common Core that the state uses. The other model of preschool that CDA, like many other community-based agencies operate, is a preschool that's near where people live and work. It's not on an elementary school campus. An example of that is CDA's The Parks Child Development Center, which is located right in the center of a low-income housing project. Other community agencies operate preschools where the parents work or go to school, and this is important because many parents have to take public transportation or walk long distances, and these preschools are conveniently located right near the parent's home or workplace. Now, turning to the governor's proposal to restructure major parts of the early education system into an efficient block grant, while on the surface seems like a great idea, but in fact it's a decision that at a local level will have negative consequences on thousands and thousands of families for years to come. Based upon our reading of the governor's proposal, we believe that community-based preschools would be defunded under this proposal. Looking at the state budget right now, there's a 0 under the column that funds the part-day preschools, and this means our preschools would likely close. This obviously would be very disruptive to children and to working families who rely on stable childcare. CDA's preschools provide year-round, full-day and part-day care. However, many school districts in our community don't typically provide full-day year-round care. So there's a gap. If our programs are defunded, we're unsure where these children would go, and receive the same quality and dosage of early education to prepare them for kindergarten. And also, community-based preschools are more cost-effective to operate than when compared to public school. Other unanswered questions include, will school districts take over current facilities in the local communities, or will they have the money to build new facilities? What would happen to our teachers who have California teaching permits but not teaching credentials? Could school districts paying union wages serve the same number of children that we serve now? And we really don't know because, as we've already discussed, the details of this proposal have not been worked out. They haven't been developed or presented to the stakeholders. And before our lawmakers decide to dismantle the current system, I hope we have all these questions answered. Now, in addition to restructuring to a block grant, the governor proposes to transition to vouchers. While that sounds very efficient for the state, it probably isn't, and there are no quality requirements. Dismantling these directly contracted programs that have been built over decades and managed by early childhood education professionals will set the state back after decades of investment in these programs. Bottom line, a single rate, single fund system sounds utopian, but what families in San Diego really need is a mixed delivery system that provides all the types of care that these families need and the unique needs of each community. So my recommendation from the field is to not implement the governor's proposals because at the local level, they won't raise quality or raise funding. Like Senator Mitchell said, it's merely rearranging the deck chairs. Instead of moving the money around and dismantling community-based preschools, the state should invest in 3 ways. First, increase the state reimbursement rate to a simplified market-driven single rate using current data. This will raise the quality of care children receive in the state preschool program. In San Diego, the SRR paid to a state preschool is $38.53 per student per day. But a private preschool on the AP voucher system with no quality requirements can bill the state $57.10 per day. These rates are completely out of balance, and the SRR needs your attention today. My second recommendation, restore funding to the centralized eligibility list. This will give families one place to go to apply for many programs and will provide the state with better data to make policy decisions. This is a low-cost, high-impact recommendation. And my last recommendation is to restore the income eligibility limit to 75% of the state median income and allow the families to continue to receive a subsidy until they reach 85%. The current limits are outdated, causing moderate income families to lose eligibility for assistance before they're self-sufficient. And as already discussed, this is going to get worse with the minimum wage increases. And I have some charts that I'd like to provide to the panel that graphically show the disparity of the state median income and also the SRR and the RMR. Thank you.
Okay, well, thank you both for your comments. It's good to hear perspectives from the field. At this point, are there questions from, yes, Senator Morlock.
Mr. Chair, Mr. Richardson, are you familiar with the Alternative Payment Program Stakeholder Group or the Direct Service Program Provider Stakeholder Group?
Yes, I am.
You serve on them?
I do not. We requested to serve on the group, and we were not selected. There were many agencies that tried out for the program, but not all could serve.
So do you believe there was anyone on those 2 groups that represented your thinking or your thought process?
Yes, I've reviewed several of the recommendations, and I think they're on the right track, because instead of dismantling the current system, blowing it up, so to speak, there are some fine-tuning that could be done that would make sense and have an immediate impact.
And then you said you were a nonprofit organization?
Yes.
Well, why does the title of your nonprofit include INC, period? Why do you have Inc. in there?
We are a California nonprofit corporation that is incorporated.
Right, most of them are.
Most of them are.
I just don't never see the Inc. used for nonprofits. I'm just curious.
There's a few agencies out there that use that. Mm-hmm.
Okay, all right, fine.
Thank you, Senator.
Senator Mitchell.
I did nonprofit work in my previous life, and I'd never seen one, so I'll believe Senator Mitchell.
Crystal Stairs, Inc., the nonprofit I was the CEO, we used Inc. Nonprofits can be Incs too.
Cool.
Don't sleep us. This is an important yet complicated chart. Could you just take a quick second to kind of walk us through so everyone is clear about the significance of what you're communicating to us?
Absolutely. So to look at this chart, you start on the bottom, and you can see some pictures of parents and
We're on the bar side, okay?
on the bar side. Because this is about parents and children that are actually out there working, earning, and the current state median income for eligibility is 70%, the dashed red line. Now you can see on the left side, things are good. There's some families that aren't making much money, they qualify for the assistance. But then at the fourth bar, you see mom works 40 hours a week at $10 an hour. Dad works $40 a week at $10 an hour. But then dad gets 7 hours a week of overtime at $15 an hour. Sounds pretty good, right? Unfortunately, that increase in income just raised them above the very low 70% income eligibility line. When that family calls their agency to report their income increase, we're going to say, congratulations on your pay raise. Unfortunately, you now no longer qualify for subsidized childcare. That's a tragedy.
So the 12-month eligibility piece that Senator Jackson talked about would help in this particular scenario because dad may have gotten 7 hours 1 week out of 52 or 3 weeks out of 52. So the 12-month eligibility would avoid this. You have subsidy, you don't, you don't, correct or incorrect?
Correct, Senator. However, there's a stipulation that California currently has that the parent must report income changes within 5 days. So one of the recommendations from the field is really make it 12-month eligibility. The parent comes in, qualifies based upon their income and situation today, and they remain qualified for 12 months. They don't have to pick up the phone and report these small changes of income, because ultimately we want to bring stability to these families. These are families on the edge of self-sufficiency. Let's give them 12 months of stability and keep them in the system and then reevaluate after a year. Now, obviously, if a family gets a huge pay raise, they win the lottery, there is a provision in the federal regulations that would require them to report that very large income raise.
Thank you.
Thank you, Senator Mitchell. I hope that you all noticed that our staff was furiously taking notes while you were talking, important issues you brought to our attention. We're going to be working with the governor's office and LAO and education to hopefully incorporate some of your suggestions. And I think your suggestion really is for the legislature to blow up the whole plan and start fresh. Am I correct in assuming that? Or do you not want to commit to that?
I will.
I would absolutely say that the system doesn't need a sledgehammer, it needs a screwdriver. We need to make some fine-tuning to the rates and the rate structure, and we need to simplify some of the over-regulation. I think what we see in the regulation and the law is legacy from years ago when the state had a very strong focus on fraud. So there's extreme reporting requirements for our families that are burdensome. Well, it's time to relax those a little bit and really focus on simplifying the system, but let's not rearrange all the funding and defund programs and reopen new ones. There's no money for that, and that would be very inefficient for the state and hurtful to the families.